Hello, thank you for joining the ICD-10 educational webinar. My name is Allison Hager-Faster, Project Manager with Scripps Health. Why are we converting to ICD-10? Well, there are several reasons why. The first is an accurate and robust division meeting training sessions are also available. Please speak to your division heads if you would like ICD-10 to come to your next divisional meeting. At Your Leisure starts with the webinars, like you're hearing today. We do offer webinars live 3 times per week. The first is on Mondays at 7 a.m., Wednesdays at 5 p.m., and Fridays at 1 p.m. We also have a physician resource page on Inside Scripps, which is more accurately referred to as the clinician's resource page, because we do like our allied health professionals to visit this as well. We have a provider resource booklet that you can pick up from any ICD-10 representative when you see them on site. Be on the lookout for emails from your leadership team, including your chief of staff. We have a learning management system here at Scripps that we'll talk about more later in the webinar, as well as clinical documentation outlines and documentation tip flyers. On the job, we have our Scripps Doc mobile app, a 24/7 hotline and email system, job aids, and badge cards. Let's take a look at several of these. The first are our badge cards. We collaborated with Dr. Sharif based on the core concepts of ICD-10 and modeled after successful badge cards at La Jolla, included to simplify our present on admission and level of care. You can see that the documentation tips are clearly laid out, and these have been very well received. See your ICD-10 representative to pick them up today. The next are job aids. ICD-10 sourced the top ICD-9 codes based on 2013 PMA data and created 66 job aids. These job aids feature the ICD-9 code and descriptions of corresponding ICD-10 codes in their descriptions. These are perfect for physicians on medical staff without billers, coders, or electronic health records. These are available on the intranet. Here's an example of a job aid. Specialty education. As I mentioned before, we've created these for all care lines at Scripps. Here is an example from pulmonary critical care of respiratory failure. These presentations can be emailed to you or presented by myself or Dr. Sharif. We also have clinical documentation outlines provided to us by Precise, a leader in performance management and technology on health information management. From Precise, the ICD-10 team gathered clinical documentation outlines with important documentation tips and strategies. Let's take a look at these. As you can see, I've chosen acute renal failure. In a quick one-page flash, it shows me everything I would need to document, including acuity, the type of necrosis, and underlying cause. We do have 260 of these. Our next modality are our LMS courses. The ICD-10 team and Precise partnership continues with over 600 ICD-10 courses based on specialty. These range in length from 15 minutes to 1 hour. This is a self-guided learning opportunity available to you 24/7. To access, go to www.scripps.org/LMS. Physicians can use their corporate ID and 123-45678 to log in. While we do offer several hundred courses, highly suggested courses are listed below. ICD-10 and the Physician, ICD-10 General Awareness, A Day in the Life of ICD-10, Prologue to ICD-10 for non-coders, Prologue to ICD-10 Procedures for non-coders, The Language of ICD-10, Specificity and Granularity, Documenting in ICD-10, Documenting in ICD-10 Procedures. At a minimum, we do suggest The Language of ICD-10, Specificity and Granularity, as well as a choice of 71 specialty-based courses, such as ICD-10 and gastroenterology. And of course, our Scripps custom course with the 6 core concepts. We do have a physician resource page. This has links to the clinical documentation outlines, the job aids, conversion tools, grand round details, mobile applications, IS applications, and any care line education. This is located on InsideScripps.org. Scripps Doc is a customized app coming out within the next few weeks. Scripps Doc was recommended by Howard Horowitz and is currently used by CME and physicians for conferences. This was a joint effort between the CMO office, the ICD-10 team, and our clinical documentation team. Scripps Doc will include those precise clinical documentation outlines we talked about, as well as code conversions. It will also contain IMO technology. This technology is currently used within Allscripts and is a leading data dictionary provider. For example, you can search for diabetes and narrow down your selection. The ICD-10 hotline and ICD-10 help email are easy ways to access the ICD-10 team. The hotline is available Monday through Friday, 7 to 5. Any inquiries left on the hotline or sent to the help email will be returned within 1 business day. These numbers are important because they'll also be used in the command center during the ICD-10 go-live. Converting to ICD-10, this will happen on October 1st. That means all services and discharges on or after October 1st must be coded using the ICD-10 code set. For any questions, once again, please call us at 858-336-0293 or ICD-10help@scripshealth.org. We've included many documentation tips throughout this presentation. These show common conditions seen in most specialties at Scripps and what needs to be documented. Let's take a look at a few. For example, ICD-10 documentation for attention deficit hyperactivity disorder would need to be further classified as predominantly inattentive or hyperactive or combined types. COPD is also quite common. You'll need to document if there is a lower respiratory tract infection and the causal organism when you know it. Document the acuity of the exacerbation as well as the severity. Document any associated usage of tobacco or tobacco products. Any place in the presentation where you see a red star is an HCC note, noting that there are 3 supporting elements needed for each condition, including final diagnoses, state of the condition, and the treatment plan. ICD-10 documentation for headache. Document the type of headache. Document if it is a post-traumatic headache or if it's drug-induced. For upper respiratory infections, specify the body part, such as the sinus cavity. Specify the infective agent. For anxiety, document the type as mixed, generalized, episodic, organic, phobic, or reaction. Document causative substances as alcohol, cocaine, and drugs. Document any associated stress reaction, such as separation anxiety. Thank you for attending our webinar today. For any additional questions, please contact the Scripps ICD-10 team.